Hello, everyone. How are you? All right. I hope everyone is doing well. Tonight, we will discuss management of care. Please write in the chat if you have any questions. If you need any help with anything, just let me know. You can request a lecture in the chat if you choose. I'm live every Friday, 6:30, and every Monday at 9 o'clock, 9 p.m. All right. So tonight we're going to review management of care. Okay, let's begin. Okay, so nurses' professional responsibilities. So we all know that as a nurse, we have certain responsibilities, certain standards that we have to hold. All right, so we all have to put the patient first. So professional responsibilities, make sure that you are taking care of the client. Clients have rights. Advocacy, you're advocating for the client. Informed consent, make sure that your client understands informed consents before you allow the client to sign anything. Advanced directives, every patient needs to know about advanced directives. Confidentiality, information, legal practices. All right, because remember, guys, we have laws that we have to adhere to. We can still go to criminal court, we can still go to civil court. Okay. Disruptive behaviors. This is something that as a nurse that we can't involve ourselves in any type of disruptive behaviors and ethical practices. Okay. That's our legal practices, our ethical practices like fidelity, autonomy, veracity. So all of those things. Okay. So nurses' responsibility. All right. So it is our responsibility to make sure that the patient understands the informed consent. So basically, if you walk into a patient's room and the patient has no idea what the procedure is about or where they're going, don't allow the patient to sign the informed consent. All right. We're supposed to advocate for the patient. We're supposed to take care of the patient. So don't allow a patient who is very confused, doesn't understand the procedure to sign an informed consent. Now, once the patient signs the informed consent, we can witness the informed consent. But ask yourself, are you going to actually sign an informed consent if the patient has no idea what the procedure is about? So just make sure that you guys understand informed consent. Patients can refuse treatment. Okay. Patients have rights. So if they say no, the answer is no. What you have to do is you have to make sure that you have the patient sign a refusal form. So normally before the beginning of shifts, you'll see nurses grab a couple refusal forms because they want them on their person. So when a patient does refuse, you'll just ask the patient to sign the the refusal of treatment form. Advanced directives. Every patient has to be aware of advanced directives. All right. So you let the patient know, are you or do you want to sign any type of living will, power of attorney for health, things like that. Confidentiality, we have to make sure that we keep all of the patient's information confidential. Information security and patient safety. These are our responsibilities. So see, these are some of the things that you guys are going to be questioned about on your NCLEX or during your exit exams, during your exams and classes. So just keep these nursing responsibilities in mind. Okay, so how do we protect our clients? We inform our clients about all aspects of care, everything. Okay, encourage the client to participate in the decision making process. Make sure you're asking the patient, is this okay with you? Are you sure this is what you want? Do you understand what is happening? Okay, Involve the family, involve the patient. All right. You don't want to start making the decisions for the patient. Let the patient make the decisions. Ensure you are competent. This is the best way. This is the most important way to ensure that you are respecting the client's rights. So you need to read and provide the requirements for a med-surg floor. If you're a med-surg nurse, you have to be competent. You have to be a competent med-surg nurse. If you're going to work on an OB floor, make sure that you are a competent OB nurse. If you're going to work on a peds floor, make sure that you are a competent pediatric nurse. This is one of the ways that we can protect our clients' rights. We have to make sure that we're competent and we're providing patient-centered care. All right, so this is a nurse competency example. So many of us haven't worked on the floor. So this is what a competency worksheet would look like. So if you're working on a medical surgical floor, you'll have to sign off on these comps every now and again. So here I put blood administration, enteral feedings, urinary care, ostomy care, wound care, NG tube placement. So I'll check off, okay, I know how to do a blood administration. Okay, I'm competent. Enteral feedings, I'm competent. Urinary care, I'm competent. Ostomy care, I'm competent. So if I am floated to another unit, all of the things that I have done on my med-surg floor, I'll feel safe doing it on a different unit. If I had to give enteral feedings on an OB floor, that's fine. I'm competent in enteral feedings. Urinary care, I can provide urinary care on an OB floor because I'm competent. If I have to do ostomy care, oh, that's fine. I can provide ostomy care on an ortho floor. I know I'm competent. But I don't want to float to a unit and start doing things that I know that I am not competent in. So this link here is a link to a competency worksheet. So you'll just click it and then you can somewhat research what the different competencies are on different floors of the hospital. So when you are giving these questions about floating, which you will, you'll understand as a med-surg nurse, I can do this. So that means that if I go to a peds floor, I can do this. It means that if I float from a med-surg nurse, a med-surg floor to an OB floor, I can do these particular skills. I'm competent. So I know a lot of nurses, a lot of nursing students have not worked in the hospital yet. So to get familiar with the different skill sets for each floor, use this link to unit competency worksheet to kind of research some of the things that you will be expected to do if you are floated to these units. Okay, it's an active learning template, and I think you'll like it. Because remember, when we speak of clients' rights, our clients deserve competent care. Okay, so don't float to a unit and start doing skills that you know that you're not familiar with. All right, so how do we protect our clients' rights? It's the Patient Self-Determination Act. This is a form that every patient receives when they are in the hospital or if they go to a doctor's appointment. Basically, we have to let the patient know, listen, you have rights. All right, the patient has the right to facilitate their own healthcare decisions. Okay, the patient has the right to accept or refuse medical treatment, and the patient has a right to advance directives. Okay, some patients, guys, they may feel more comfortable talking to you about an advance directive than their child. No one wants to have that conversation with their children. So this is something that we do. We provide as nurses. We advocate for our patients. If our patients want to sign a DNR, if they want to sign an A&D, this is something that we make sure that we discuss with the patient. It's required. The Patient Self-Determination Act. They do get the form, but they may want to talk to you on a one-on-one basis about some life decisions. All right. So how do we protect our clients? Again, a competent client. Most people think that because you are 100 years old, 150 years old, that, oh, well, not 150, but you know what I mean. 100 years old, you're not competent. Okay. Listen, competency is a legal term. You are competent until you are legally deemed incompetent. So, as healthcare providers, we just can't go around and saying, oh, this person is incompetent. No. Is there a legal document saying that this patient is incompetent? Well, if there's not a legal document, guess what? They are competent and we must treat them as such. So, to be deemed incompetent, you have to go through a legal proceeding. The patient may be appointed a legal guardian or legal representative, but still the patient's wishes are still considered. So, as healthcare providers, just understand that if someone is incompetent, it's because they are legally deemed incompetent, not because, oh, they are a little older. Okay. Now, in Florida, is 18 or older. You have, in order for to be a legal adult, in order to sign consent forms, you have to be 18 years or older. But here, because we serve a large elderly population, we tend to have this discrimination. It's called ageism. We feel like, oh, someone is 85 years old, they can't make decisions on their own. That's not true. All right. Unless someone is deemed incompetent legally, then the patient is competent and we have to respect the client's wishes. Okay. Can the client consent to medical treatment? Can the patient retain the given information? Okay. If they can, guess what? They're competent. So we have to respect their wishes. AMA. A patient has the right to leave against AMA. Okay. The patient has the right to leave. We have to do as nurses is notify the physician, have the client to sign an against medical advice form. And this is the tricky part. This is what most people don't know. You must explain the medical risk of leaving AMA to the client. You have to explain the medical benefits of remaining in the facility and document if the patient simply refuses to sign. So we have to protect the patient. So if a patient wants to leave against medical advice, it is our responsibility to notify the physician to let him know that the patient wants to leave and explain the medical risk of leaving AMA to a client. Explain the benefits, the medical benefits of the patient remaining in the care of the facility. If the patient refuses, the patient refuses. We can't hold someone against their will, but we have to document that we did educate the patient. And also make sure if the patient, if he just refuses to sign, because some patients will just walk out of the facility, just document that the patient refused to sign. Okay, advocacy. They say this is the most important part of our jobs, guys, advocating for the patient. Again, we are working with patients that may be very, very ill and can't speak for themselves. I've had patients like that. I'm sure you guys have seen patients that they can't speak for themselves. So it is our place, or it's our responsibility to advocate for our clients. We have to make sure that we're always providing patient-centered care. It is about the patient. Respect the client's decision. Okay. Support, help, guide. This is our responsibility. We support, we help, we guide our patients. Okay. We're always advocating for the patient. We are the voice of the patient. All right. So remember, patient centered care. Advocacy. All right. Advocacy becomes a big, major issue when it comes to things like advanced directives or end of life decisions, informed consent, because sometimes family members don't want to say goodbye. Or sometimes a family member may, up until that point of the patient's hospitalization, make all the decisions for the patient. And then when they get to the hospital for their mom, or when they get to the hospital for the dad, they find out that the father or the mother has signed a DNR. Okay. Some people do not want to let their mom or dad, uncles or cousins, they don't want to let them go. Okay. But Remember, as a nurse, we have to respect the client's wishes. Okay? If the patient has a signed advance directive, signed end of life decision, signed informed consent, and the patient is competent, we have to respect the client's wishes. Okay, we are there to take care. We do provide family centered care, but remember, we are there to take care of our clients. So we have to respect their wishes. So you'll see a lot of advocating when it comes to advanced directives, end of life decisions, informed consents. Okay, so how do we protect our clients? Advocacy. We also have to we can advocate by being sensitive, tactful, and remember the word assertive. Nurses have to be assertive. We can't be timid and docile. We have to be assertive because remember, you're speaking for the patient. Knowledgeable. You have to know your stuff and you have to be skillful. You can have the best intentions, but if you don't know how to put in a Foley catheter, you can cause some serious infections. So you have to be sensitive, tactful, assertive, okay? Knowledgeable and skillful. All right. This is how we protect our clients' rights. Now, when it comes to protecting our clients and the informed consent, again, okay? Witness the signature if and only if the patient understands the benefits, if the patient understands the risk, and the patient understands other options. So, how do I know if the patient understands these things? Should I witness this informed consent? Talk to your patient. Sit down with your patient and ask the patient, listen, do you understand the benefits of this procedure? Do you understand the risk of this procedure? Do you know there's other options? And if a patient can verbalize all these things to you, witness the informed consent. We need to advocate for the patient, but do not go into the room and sign or witness an informed consent if your patient can't answer these questions. Okay, this is a telltale sign that the patient doesn't understand. Okay, so don't witness that. Essential components of advocacy. All right. Some of the things that you and I, and as nurses, um, the informed consent, the essential is we reinforce an informed consent. Always remember that term. All right. We reinforce, we witness, we verify, and we advocate. It's up to the doctor to go in and explain the procedure to the patient. I can reinforce some teachings, but I'm not supposed to go into the room and explain an entire procedure. If I have to explain it, the patient doesn't know. The physician needs to come back, and I want you guys to make sure you remember this. The physician needs to come back in and explain the procedure to the patient. If this patient does not understand the procedure, the physician must be notified because he needs to come back in and explain the procedure to the patient. We can reinforce some things like, no, the procedure will be at 10:30, not 10:25. Or yes, you can you'll be NPO for the procedure. But for me to go in and explain a cardiac cath and the reasoning behind the cardiac cath, the risk of a cardiac cath, the benefits of the cardiac cath, the options of the cardiac cath, that's not my place. The physician needs to do that. I can reinforce some things. If a patient has a cardiac cath, he can't move for 4 hours after the procedure. If he tells me, well, the doctor said I can move like 5, I can't move until like 5 hours after the procedure. I may say, yeah, like 4 or 5 after 4 or 5 hours, you have to remain in bed. Things like that. I can reinforce it, but the foundation is already there. I'm not supposed to go into a facility or into a patient's room and explain a procedure. Okay. So make sure that you guys remember that word reinforce. All right. Again, and I'm sorry to be beating this horse, but you're going to get a lot of questions on informed consent. All right. So, informed consent, make sure that the client understands the nature of the treatment, alternatives, risk, benefits, and opportunities. All right. Now, the big issue, the big question, implied consent. Now, this right here, this is a doozy because, okay, what is implied consent? Okay, so I researched some things for you guys. Implied consent is allowed in emergency situations. Okay, it's not preferred, but it is allowed in emergency situations. May apply during surgical procedures, meaning sometimes during a procedure, the physician in the beginning may think, okay, I only have to do this, but now I must do this also. So it's not preferred, but it may apply during surgical procedures. Implied also by a patient's conduct. If I go into the room and I say, well, can I take your blood pressure? And the patient lifts his arm, then that's implied that, okay, he understands that I need to take his blood pressure. And he's saying, yes, it's implied by his behavior. And remember, they call it tacit consent. So treatment implied consent. So that basically means that, okay, I'm in the facility. If a nurse tells me, okay, we need to ambulate today, and I make motions to get out of the bed, even though I'm not talking to the nurse, that means that it's implied, okay, that the patient agrees. The one thing that if I were you guys, I would read about are emergency situations and implied consent. Go to your Google images and type in implied consent. Okay? And there's a picture of a woman inside of a crocodile. The crocodile ate her. And you have a nurse saying, "Do you want to sign a consent form?" So go look at the images because it'll put implied consent into perspective for us that have never worked in the hospital. Okay. So there's a lot of images that kind of tell you guys, okay, if someone is in the mouth of an alligator, how are they going to sign an informed consent? Okay, that's something implied. Like, I know you don't want to be eaten by this alligator or this crocodile. So I'm just going to take you to surgery because I know you don't want to be eaten alive by a crocodile. So just always remember, like, implied consent. If someone is in an emergency situation, do you really think a doctor is going to withhold emergency care for someone who is in an emergency situation? No, it's implied that you want me to help you. Okay. So just read as many scenarios as you can on that topic. Look at as many pictures so that can become real to you. Implied consent. Okay. Interpreter. Interpreter. We protect our clients by the use of interpreters. Okay. Remember that as healthcare providers, guys, even though we may be bilingual, we should not be using our coworkers as interpreters. Do not use a family member. Do not use a coworker. Use a trained medical interpreter. Now, I must tell you, these exit exams, they get very, very tricky when it comes to this interpreter. They're going to throw different scenarios at you. I tried to find more scenarios, but it just doesn't I can't find anything as of yet. But when it comes to a medical interpreter, guys, there's so many different situations, so many scenarios. But I want you guys to know that they do not want the family member used as an interpreter. They do not want a coworker used as an interpreter. They want a medical interpreter. Okay. Granting individuals authorized to grant consent for another person. Okay. So, of course, a parent of a minor, a legal guardian. This is someone who has gone to court and is a legal guardian. The judge has granted the person legal guardianship. A legal court specified representative, a healthcare surrogate, a spouse, or the closest available relative. And underline that or write that down. Closest available relative. Okay. All right. So these are individuals authorized to grant consent for another person. Advanced directives. The Patient Self-Determination Act. I want you to really embrace this advanced directives. This is one way that we protect our clients. The Patient Self-Determination Act, it outlines the patient's rights. It explains advanced directives. It gives the options of healthcare representatives. So this is something that we have to give our patients, or the patients have already received it when they go in. If you're working on the floor, if you're working on a unit, if the patient came in through the emergency department, please believe the nurse gave the patient a Patient Self-Determination Act. All right. It is mandated. All right. So we all have to adhere to this. We all have to educate our patients. Okay. Now, there are different components of the advanced directives. We protect our clients with advanced directive. This is a living will. So I put a little examples here so you guys can kind of understand the difference between all three. All right. So, living will. So just listen to this. Being of sound mind, willfully and voluntarily make known my desires that my moment of death shall not be artificially postponed. So this is someone who, you see, being of sound mind, willfully and voluntarily make known my desires that my moment of death shall not be artificially postponed. This is someone who is alive and is saying that I'm of sound mind and body. And I'm telling you that I don't want to be artificially postponed. Let me go. This is someone who was alive. It's a living will. They did it while they were of sound mind and body. Okay. Now, a DNR, look at a DNR. I have discussed my health status with my physician. I request that in the event my heart and breathing should stop, no person shall attempt to resuscitate me. Okay, that's a DNR. And look at the A&D, allow natural death. I have discussed my health status with my physician. I request that in the event my heart and breathing should stop, no person shall attempt to resuscitate me. So look at a living will and a DNR. Okay. So that should put it into perspective for you. All right. So here's a little picture for you. This is a power of attorney. Now look at this power of attorney. Okay. Known all men by these presents that I blank blank of Florida as authorized by Florida law do thereby appoint to manage and conduct my affairs. This power of attorney shall be non-delegate except as otherwise provided in Florida statutes. So this is someone who is appointing another person to handle their affairs. Okay, it's a power of attorney for health care. All right, it's something that the patient normally signs when he is of sound mind and body. Okay, he's saying, listen, this person is allowed to make the decisions for me when I can't make them for myself. Okay. Just remember, guys, that nurses, how do we protect our clients' rights? Advanced directives? Well, just remember, always remember that the client is a priority, and inform all members of the healthcare team about the patient's advanced directive. Make sure you know and everyone else knows. So, confidentiality, guys, and information security. All right, this is very important. We have to protect the patient's health information. We have to discuss patient's information in designated areas. Remember, patient's information is a need to know basis, guys. So, this means that if a nurse comes from another floor to ask about this patient, guys, is she involved in the patient care? Should I be telling another nurse? Should I be gossiping about a patient? No. Okay. And make sure that you always adhere to the HIPAA regulations, guys. Patient information is a need to know. If they are not working directly with that patient, then they should not be asking about that patient, or you shouldn't be discussing that patient's health information with them. All right. So just remember that. Make sure you remember that. Protected health information again. Sometimes, guys, if a family member calls about a patient's information, they need to make sure they have a code system or a code. Remember that we have to protect the patient information. We don't know who's calling about the patient. So make sure there's a code system. Make sure that if they want information, they have to know the code. So they have to arrange that with their family members. So this is one way we protect our clients' rights. Information security. How do we protect our information? How do we protect the client's information? Well, we don't share passwords ever. Make sure you log off before you walk away. During the code, you must log off from the computer before you walk away from the computer. Protect patients' information. So that means shredding information. Don't make copies of the information. I know sometimes you'll see a nurse make copies for students. They shouldn't be doing that. And shred any printed information. Most units have a shredder box. Throw the printed information in the shredder box. So we have to protect our patients' information, private health information. Social media. We're not allowed to make comments or take pictures of our patients, disclose our patients' health information on social media. You're not allowed to do that. So be careful what you post on social media. Okay, especially as a healthcare professional, because it can come back and bite you in the end. Some facilities, they have a no tolerance, zero tolerance. So you're not allowed to discuss your coworkers on social media. You're not allowed to discuss your patients on social media. So just be very, very careful about what you put on social media. Okay, we can also protect our patients by allowing them or referring them to credible websites. Make sure they're reading credible articles and be aware of the disclaimers that most of these medical sites have. Most patients, they'll come in and they've read something on a site. It may not be a reputable site, so we have to direct them. And we have up to date in the facility, and most facilities have Lippincott, so you can print out information for the patient to read. Okay, remember legal practice. In order for you guys to ensure that you don't get into any trouble with the Florida Board of Nursing, with your facility, provide care consistent with established standards of care. Okay, don't make sure that you know your responsibilities before you start working. Okay, um things happen, but as long as you are within the standards of care, you're covered. And stay within your scope of practice. Okay, so that's a big deal, especially when it comes to interpreters. Stay within your scope of practice. And informed consent, stay within your scope of practice. Okay, remember, if something happens, they're going to say, were your actions prudent and reasonable as a nurse? So just always remain within the standards of care. These are some laws that govern us also, guys, that we have to make sure that we are aware of. It's the ADA, Americans with Disabilities. You have the EMTALA, Patient Self-Determination Act, and of course HIPAA. So these are sources of laws that as healthcare providers that we must adhere to. We must be aware of. Okay, Tamiko, any questions for me? All right. Any questions for me, guys, in the chat? All right, so let's talk about criminal law. So Tamiko, I want you to write down criminal law for this one. Criminal versus civil law. All right. As nurses, we have to be very aware that we follow. We can still go to court. We can still be fined, held criminally liable, or we can go to civil court. So make sure that you are not doing anything outside of the scope of nursing. All right. So criminal law is a public law and relates to the relationship of an individual with the government violations of criminal law. So that's committing a felony, fraud, all of those things can apply to you. And then civil law protects the individual rights of people, like a tort. So I want to talk to you mainly about unintentional torts and quasi-intentional torts. So I want you to write that because now it's time for active learning. All right, so let's do some active learning. I want you to write unintentional tort and quasi-intentional tort. All right. So the first unintentional tort is negligence. Okay. It's a practice or misconduct that does not meet expected standards. So let's say, for instance, you have a patient that is a fall risk and you didn't protect this patient. Okay. If you didn't protect this patient falls, they can find you negligent. Let's say that you did not know that the patient was bleeding precautions and you did not educate the patient about how to take care of himself, electric shavers, contact sports. You didn't educate the patient. That type of stuff, that's negligence. Okay? That's what they consider negligence. When you don't implement safety measures like seizure precautions. Okay? That's what they'll consider negligent. And then I want you to write down malpractice. All right. So let's say, for instance, if the dosage is 20 milligrams and you gave a patient 200 milligrams, that's malpractice. Let's say, for instance, you were supposed to give someone 0.5 milligrams of a medication and you gave 500 milligrams of a medication. So that's what they consider malpractice. So negligence is when you have not put in place safety measures, you haven't implemented safety measures. And malpractice is administering large dosage of medication. All right. Let's say, for instance, you didn't do that calculation, that dosage calc correctly. They're going to consider that malpractice. All right. So those are unintentional. And let's talk about quasi intentional torts, invasion of privacy. Okay. Let's say, for instance, if you are a nurse on floor 3 and you want to know about a patient on floor 2, that's invasion of privacy. When you have these celebrities walking, admitted into the hospital, and you have all the nurses reading their charts. That's what you consider invasion of privacy. We're not allowed to do that. It's need to know basis. If you are not working directly with that patient, you will get in some major trouble if you clicked into that patient's chart. That's invasion of privacy. And defamation, that's just false communication, telling things that are not true. Okay. I'm trying to ruin someone's reputation. Now, defamation is with your coworkers also. Okay. Defamation, that's your coworkers. Okay. So saying things on public platforms or social media, that's considered defamation. Libel, writing things about someone, writing. Okay. A nurse documents in a client's health record that a provider is incompetent. They can consider that liable. Saying that a CNA is sleeping during a shift, that's liable. Saying a nurse a nurse did not medicate a patient when she should have, that's liable. So you have to watch what you document. Okay. And then slander, saying things about a coworker, saying things about a physician that are not true, slander. So these are all considered quasi intentional torts. And then I want you to write down intentional. Someone intentionally, you intentionally assault someone, saying things, threatening them, saying to a patient, if you get out of that bed, I'm going to tape you to the bed. That's assault. Saying, if you leave that room, or I'm going to make you regret it. That's assault. And battery is when you actually do something to the patient, when you actually put your hands on the patient. Battery. Okay. It can be, even restraining the client against or administering an injection that the client doesn't want. Those things can be considered battery, and we're not allowed to do that as a nurse. Okay. And then false imprisonment. All right. Write down false imprisonment. This like you're forcing a competent person to stay in a facility. This is why we allow patients to sign out AMA. So I want you to write down false imprisonment, because if you hold somebody against their will, then that's false imprisonment. And you can't do that even as a nurse. We have to let the patient leave AMA, even if we don't want the patient to leave. We know that the medical risk, we know that the patient may pass away. We still have to let the patient leave, because the patient can charge you for false imprisonment. Okay. So those are some things, criminal law. And then the last act of learning I want you to know about and to write out is, I want you to understand what an impaired coworker is. Okay. An impaired coworker is someone who is inebriated. Maybe they may be under the influence of alcohol or drugs. We are supposed to, this is something that this nurse is going to be terminated right away. Okay. This is a serious business. There are a lot of questions, and they'll say, if you have a patient or a nurse who is under the influence, do you call the Florida Board of Nursing? Well, I want you to think about this. If it were your family member and you knew the nurse was under the influence, would you go all the way to the nurse's station, call the Florida Board of Nursing while the nurse is there with your family member? So when you think of someone under the influence, I want you to think of, this is a nurse that needs to be stopped right away. So that's the first scenario, because this nurse is immediate. All right. So they have to be dismissed immediately. Now, if you do witness a nurse who is impaired, you can report it to the charge nurse right away, and also let the supervisor know that it occurred. All right. So, two scenarios. One, you may have to stop it right away. If they don't give you that option, make sure you use the chain of command. Go to the nursing charge nurse, go to the charge nurse, and then go to the manager. All right, Tamiko, that's all I got. Any questions for me? All right. So I'll be live tomorrow. So just let me know if you guys need anything and have a great night.